Sarah Martinez had always known she was different from the other medical professionals at Metro General Hospital. While doctors walked the halls with their heads held high, stethoscopes draped around their necks like badges of honor, she moved quietly through the corridors in her blue scrubs, often invisible to those who thought themselves more important. At 28 years old, Sarah had been working as a registered nurse for 6 years. She had started right after graduating from nursing school, bright-eyed and eager to help people. But the reality of hospital life had been a harsh wake-up call. The hierarchy was clear, and nurses were often treated as nothing more than glorified assistants. "Sarah, can you clean up room 302? Dr. Williams called out one Tuesday morning, barely looking up from his clipboard. His tone was dismissive, as if she were a janitor rather than a skilled medical professional with years of training. "Of course, doctor," Sarah replied, maintaining her professional composure. She had learned long ago that arguing or correcting doctors about her actual role would only make things worse. The emergency department at Metro General was always busy, but today felt particularly chaotic. Ambulances arrived one after another, their sirens wailing through the afternoon air. Sarah moved between patients with practiced efficiency, checking vital signs, administering medications, and providing comfort to those in pain. Dr. Rebecca Stone, the chief of emergency medicine, was known for her sharp tongue and even sharper opinions about hospital staff. She had made it clear from day one that she believed nurses were simply there to follow orders, nothing more. "Martinez!" Dr. Stone snapped as Sarah finished updating a patient's chart. "The coffee in the break room is cold. Make a fresh pot." Sarah felt her jaw clench, but she nodded. "Right away, doctor." As she walked to the break room, she overheard Dr. Stone talking to a group of medical students. "Remember, doctors make the real decisions here. Nurses are just there to carry out our orders. They don't have the education or training to handle complex medical situations." The word stung, but Sarah had heard variations of this speech countless times. She focused on her work, knowing that her actions spoke louder than their words. When Mrs. Chen came in with chest pains, Sarah was the one who noticed the subtle signs that others had missed. When the teenage boy arrived after a motorcycle accident, she was the one who stayed with him through the night, monitoring his condition and alerting doctors to changes before the machines even registered them. Sarah's background wasn't typical for a nurse at Metro General. Before nursing school, she had served 4 years in the Army as a combat medic. She had seen things that most of these doctors had only read about in textbooks. She had performed emergency procedures in field hospitals under enemy fire, saved lives in conditions that would make a sterile hospital room seem like a luxury resort. But nobody at the hospital knew about her military service. Sarah didn't talk about it, and nobody asked. To them, she was just another nurse who should be grateful to have a job cleaning up after real medical professionals. The Army had taught Sarah more than just medical skills. It had taught her patience, discipline, and how to stay calm under pressure. These qualities served her well in the hospital, especially when dealing with difficult colleagues and impossible situations. One afternoon, while Sarah was restocking supplies in the trauma bay, she overheard Dr. Williams talking to Dr. Stone about an upcoming visit from some government officials. "They said it's some kind of inspection or evaluation," Dr. Williams said, his voice low and concerned. "Something about our emergency preparedness protocols." "Probably just bureaucrats looking to justify their jobs," Dr. Stone replied dismissively, "as if we don't know how to run a hospital." Sarah continued her work, but she listened carefully. In the Army, she had learned that information was valuable, and unexpected visits from government officials usually meant something important was about to happen. The next morning, the hospital administrator, Mr. Robert Chen, called a staff meeting. The main conference room was packed with doctors, nurses, and other staff members. Sarah sat in the back as usual, while the doctors took the front rows. "As some of you may have heard," Mr. Chen began, "we're expecting a visit from federal officials next week. They're conducting an evaluation of our emergency response capabilities, particularly our ability to handle mass casualty events and coordinate with military medical personnel. Dr. Stone raised her hand. What kind of evaluation exactly? Are we being audited? Not an audit, Mr. Chen clarified. More like a readiness assessment. Apparently, Metro General has been selected as a potential partner facility for certain classified operations. The details are need to know, but I can tell you that this is a significant opportunity for our hospital. The room buzzed with excited whispers. Being selected for government partnership meant prestige, funding, and recognition. For the doctors, it meant advancement opportunities and the chance to work on high-profile cases. What do we need to do to prepare? Asked Dr. Martinez, the head of surgery. Just continue doing what you do best, Mr. Chen replied. Provide excellent medical care and demonstrate our professionalism. They'll be observing our normal operations, so business as usual. After the meeting, Sarah returned to her duties, but she couldn't shake the feeling that something bigger was coming. In the Army, she had been involved in several joint operations with civilian hospitals, and she knew that these evaluations weren't just routine paperwork exercises. Someone, somewhere, was planning for a situation where they would need a hospital that could handle military personnel and classified operations. Over the next few days, the atmosphere in the hospital changed. Doctors were more attentive to their appearance, nurses were reminded to be extra professional, and everyone seemed to be on their best behavior. But Sarah noticed that the fundamental attitudes hadn't changed. If anything, the doctors seemed even more dismissive of the nursing staff, as if they wanted to make it clear who the real medical professionals were. Sarah, make sure all the supply rooms are perfectly organized, Dr. Stone instructed. We can't have these government people thinking we run a sloppy operation. Of course, Doctor, Sarah replied, even though the supply rooms were already meticulously organized. She had implemented a new inventory system months ago that had significantly improved efficiency, but Dr. Stone had never acknowledged her contribution. The irony wasn't lost on Sarah. The same people who dismissed her as only a nurse were now depending on her attention to detail and organizational skills to make a good impression on the federal officials. As she worked late into the evening, restocking and reorganizing supplies that didn't need it, Sarah thought about her time in the Army. She remembered the respect she had earned from her fellow soldiers and officers. In the field, nobody cared about your rank or title when someone's life was on the line. What mattered was competence, reliability, and the ability to perform under pressure. The night before the evaluation was scheduled to begin, Sarah was working the late shift in the emergency department. It was quieter than usual, with only a few routine cases coming in. She was updating patient records when Dr. Williams approached her desk. Martinez, he said, his voice unusually tense. I need you to cover for Nurse Peterson tomorrow morning. She called in sick and we can't be short-staffed during the evaluation. No problem, Doctor, Sarah replied. I can work a double shift. Dr. Williams nodded curtly and walked away, but not before Sarah caught a glimpse of the stress in his eyes. Despite his confident facade, he was nervous about the evaluation, too. As Sarah finished her paperwork for the night, she reflected on the events of the past week. The hospital staff was scrambling to impress people they had never met, for reasons they didn't fully understand, but Sarah had a feeling that whatever was coming would test them in ways they hadn't anticipated. She gathered her things and prepared to leave, knowing that tomorrow would bring the federal evaluation and possibly the most important day of her career. She had no idea that within 24 hours everything would change, and the same people who dismissed her as only a nurse would be looking to her for answers they didn't have. Walking out of the hospital into the cool night air, Sarah allowed herself a small smile. She had faced enemy fire in Afghanistan and saved lives in impossible conditions. Whatever challenge tomorrow brought, she was ready for it. The Army had taught her that respect wasn't given based on titles or degrees. It was earned through actions, competence, and the willingness to step up when others stepped back. Tomorrow, she would have the chance to prove what she was really capable of, even if the people around her weren't ready to see it yet. As she drove home through the empty streets, Sarah couldn't have imagined that within hours, a black Apache helicopter would land on the hospital's helipad, carrying passengers with White House clearance and a mission that would put her military training and medical expertise to the ultimate test. The morning of the federal evaluation started like any other day at Metro General Hospital. Sarah arrived early for her double shift, knowing that the place would be buzzing with nervous energy. She grabbed a quick coffee from the break room and headed to the emergency department to begin her rounds. Dr. Stone was already there, barking orders at the staff and making sure everything looked perfect for the arriving officials. Her voice carried across the department as she reminded everyone about proper protocols and professional behavior. "Remember, these people are here to evaluate our emergency response capabilities," she announced to the gathering staff. "We need to show them that Metro General is a world-class facility with world-class medical professionals." Sarah noticed how Dr. Stone's eyes swept over the doctors with approval, but barely acknowledged the nurses. The message was clear. The doctors were the ones who mattered for this evaluation. The federal officials arrived at 9 o'clock sharp. 3 men in dark suits, carrying briefcases and wearing expressions that gave nothing away. They were led by Agent David Morrison, a tall man with graying temples who introduced himself as being from the Department of Health and Human Services. With him were Agent Collins from the Department of Defense and Dr. Richard Hayes, who identified himself as a military medical liaison. Sarah watched from her station as Dr. Stone and the other senior physicians greeted the visitors with excessive enthusiasm. The tour began in the main lobby, moved through various departments, and eventually arrived in the emergency area where Sarah was working. "This is our emergency department," Dr. Stone explained, gesturing proudly at the modern equipment and organized layout. "We handle over 50,000 cases annually, with a patient satisfaction rate of 93%. Agent Morrison nodded, making notes on his tablet. His eyes moved methodically around the room, taking in details that the others seemed to miss. Sarah noticed that he spent a lot of time observing the staff interactions and workflow patterns. "What's your protocol for mass casualty events?" Dr. Hayes asked. Dr. Williams stepped forward eagerly. "We have extensive emergency preparedness protocols. We can handle up to 40 critical patients simultaneously, and our trauma teams are among the best in the region." "What about coordination with military medical personnel?" Agent Collins inquired. There was a brief pause before Dr. Stone answered. "Well, we've had limited experience with that specifically, but our medical staff is highly trained and adaptable." Sarah could see that the federal officials weren't entirely satisfied with the answers. They were asking specific questions about military medical procedures, field triage protocols, and emergency communication systems. The doctors were giving textbook answers, but it was clear they had never actually dealt with these situations in real life. The evaluation continued throughout the morning, with the officials observing various procedures and interviewing key staff members. Sarah went about her regular duties, caring for patients and managing her assigned cases, but she could feel the tension in the air. At 11:30, everything changed. Sarah was checking on an elderly patient with pneumonia when she heard it, the distinctive whop, whop, whop of helicopter blades approaching fast. But this wasn't the familiar sound of their medical helicopter. This was deeper, more powerful, with the unmistakable rhythm of a military aircraft. She looked out the window and saw it approaching. A black AH-64 Apache helicopter, sleek and menacing against the clear morning sky. It wasn't displaying any visible markings except for a small American flag on the tail. The Apache circled the hospital once before coming in for a landing on the helipad. Hospital staff began gathering at windows, pointing and murmuring among themselves. Apache helicopters didn't just show up at civilian hospitals without a very good reason. Dr. Stone's voice came over the hospital intercom. All department heads, please report to the emergency department immediately. This is not a drill. Sarah abandoned her current tasks and moved toward the emergency area, her military training automatically kicking in. In the Army, unexpected helicopter arrivals usually meant one thing: casualties incoming. The federal officials were no longer observing. They were in control. Agent Morrison was speaking rapidly into a satellite phone while Dr. Hayes pulled on surgical gloves. Agent Collins was coordinating with someone over a military radio. Dr. Stone looked confused and slightly panicked. What's happening? This wasn't part of the evaluation. The evaluation just became real, Agent Morrison replied curtly. We have incoming wounded from a classified operation. ETA 3 minutes. What kind of wounded? Dr. Williams asked. Gunshot wounds, possible explosive injuries, severe blood loss, Dr. Hayes answered. And one of the casualties is carrying classified information that cannot be compromised under any circumstances. The emergency department erupted into controlled chaos. Doctors began preparing trauma bays while nurses readied equipment and supplies. But Sarah could see that many of them were overwhelmed. They had trained for mass casualty events, but this was different. This was real military trauma with national security implications. The first stretcher came through the doors carried by 2 men in military fatigues. The patient was unconscious, with multiple gunshot wounds to the chest and abdomen. Blood soaked through the field dressings and his breathing was labored. Male, approximately 30 years old, 3 GSWs to the torso, significant blood loss, vitals declining, one of the medics reported. Dr. Stone moved to take charge, but she hesitated when she saw the extent of the injuries. These weren't the kind of trauma cases they usually handled at Metro General. This patient needed immediate surgery, blood transfusions, and complex trauma care. The second stretcher arrived 30 seconds later. This patient was conscious but in severe pain, with what appeared to be shrapnel wounds across his left side and a compound fracture of his right arm. This one's priority alpha, the medic announced. He's carrying sensitive materials. Dr. Williams stepped forward to examine the second patient, but Agent Collins immediately intervened. Only personnel with appropriate clearance can treat this patient. What does that mean? Dr. Williams demanded. We're all medical professionals here. It means, Agent Morrison said, consulting his tablet, that we need someone who's been cleared for classified medical operations. The room fell silent. Nobody at Metro General had that kind of clearance. The doctors exchanged confused glances, and Dr. Stone's face went pale. That's when Dr. Hayes looked directly at Sarah. Nurse Martinez, according to our records, you served as a combat medic with the 82nd Airborne Division. You held a top-secret security clearance. Every head in the room turned toward Sarah. The doctors stared at her in shock. Dr. Stone's mouth literally fell open. That's correct, sir, Sarah replied, her military bearing automatically returning. Staff Sergeant Martinez, medical specialist, served 2 tours in Afghanistan. Your clearance was never formally revoked, Dr. Hayes continued. You're authorized to treat the classified patient. Dr. Stone found her voice. This is ridiculous. She's just a nurse. These patients need doctors, not... With respect, Doctor, Agent Morrison interrupted, Sergeant Martinez has more combat trauma experience than your entire medical staff combined. She's seen and treated injuries like these under battlefield conditions. Sarah stepped forward, her professional confidence taking over. Sir, I can handle the classified patient, but the other casualty needs immediate surgical intervention. Dr. Williams, you need to get him to OR2 right now. For a moment, Dr. Williams hesitated, clearly struggling with the idea of taking orders from a nurse, but the patient's condition was deteriorating rapidly, and there wasn't time for ego battles. You're right, he said finally, and began directing the first patient toward surgery. Sarah turned her attention to the classified patient. He was conscious but clearly in significant pain. The shrapnel wounds were bleeding heavily, and his right arm needed immediate stabilization. "What's your name, soldier?" she asked gently, beginning her assessment. "Lieutenant James Parker," he replied through gritted teeth. "And ma'am, I need to speak with whoever's in charge of security here." Agent Collins stepped forward. "I'm handling security, Lieutenant. What's your status?" "The package is secure," Parker said, indicating a sealed metal briefcase handcuffed to his uninjured left wrist. "But I need medical attention before I can transfer it." Sarah worked quickly and efficiently, cleaning and dressing the shrapnel wounds, while assessing the damage to his arm. Her hands moved with practiced precision, and her voice remained calm and reassuring. "The arm needs surgery, but the bone fragments aren't displaced," she reported to Dr. Hayes. "The shrapnel wounds are superficial but extensive. He's lost blood, but not critical amounts." Dr. Stone watched in amazement as Sarah worked. This was a side of her employee that she had never seen. The quiet, often dismissed nurse had transformed into a confident, skilled medical professional who clearly knew exactly what she was doing. "We need to get him to surgery for the arm," Sarah continued. "But the wounds need to be cleaned and debrided first. I can handle that here if you want to prep the OR." Dr. Hayes nodded. "Do it. Collins, maintain security on the briefcase. Morrison, I need to contact Washington with a status update." As Sarah worked on Lieutenant Parker's wounds, she could feel the eyes of the entire emergency department staff on her. The doctors who had dismissed her as only a nurse were watching her demonstrate skills and knowledge they didn't possess. "Where did you learn to do that?" Dr. Stone asked quietly, moving closer to observe Sarah's technique. "Forward operating base in Kandahar," Sarah replied without looking up from her work. "We got casualties like this every day. When you're under fire and the nearest surgeon is 200 miles away, you learn to do whatever it takes to save lives." The third stretcher arrived just as Sarah was finishing with Lieutenant Parker. This patient was in critical condition, multiple trauma, barely conscious, and losing blood fast. "This one's touch and go," the medic reported. "Lost a lot of blood in transport." Dr. Williams had just finished getting the first patient to surgery, and he returned to find Sarah directing triage for the new arrival. "Type and cross-match for 6 units of O-negative, she called out. "Get 2 large-bore IVs started and prep for emergency surgery. This patient has possible internal bleeding." Dr. Williams stared at her. "How do you know all this?" "Because I've seen it before," Sarah replied matter-of-factly. "In the field, you learn to read trauma quickly. This patient has the signs of internal bleeding, dropping blood pressure, increasing heart rate, skin pallor. He needs surgery in the next 10 minutes or we're going to lose him." Dr. Stone stepped forward. "I'll take him to surgery." "Doctor," Sarah said respectfully but firmly, "with your permission, I'd like to assist. I've done emergency abdominal surgery under battlefield conditions." The statement hung in the air like a challenge. Dr. Stone looked around the room, seeing the federal officials watching, seeing her own staff looking at Sarah with new respect. "Yes," she said finally, "I'd appreciate your assistance." As they wheeled the patient toward the operating room, Agent Morrison approached Sarah. "Sergeant, I need to ask, why didn't you tell anyone about your military background?" Sarah paused at the OR doors. "Sir, nobody asked. And around here, being just a nurse means people don't want to hear about anything else you might be capable of." She pushed through the doors, leaving behind a room full of people who were beginning to understand that they had seriously underestimated the quiet woman in blue scrubs who had been working among them for years. The surgery lasted 3 hours and 27 minutes. Sarah stood beside Dr. Stone throughout the entire procedure, her hands steady and her voice calm as she anticipated each need and provided assistance that went far beyond what anyone expected from a nurse. "Clamp," Dr. Stone said, and Sarah had it ready before the word was fully spoken. "There's internal bleeding from the spleen," Sarah observed, pointing to an area that Dr. Stone had missed. "We need to get in there." Dr. Paul Stone looked where Sarah indicated and saw she was right. "Good catch. How did you spot that?" "The blood pooling pattern," Sarah explained while helping to expose the area. "I've seen this type of injury before, usually from explosive devices or high-velocity impacts." Throughout the surgery, Sarah demonstrated knowledge and skills that impressed not only Dr. Stone, but also Dr. Hayes, who was observing from the gallery. Her military medical training had given her experience with trauma cases that most civilian doctors would never encounter. When they finally closed the patient up, Dr. Stone pulled off her surgical gloves and looked at Sarah with a mixture of respect and bewilderment. "That was exceptional work, Nurse Martinez. I had no idea you were capable of that level of surgical assistance." "Thank you, Doctor," Sarah replied simply, beginning to clean up the surgical area. "The patient should recover fully. The spleen repair will hold, and there doesn't appear to be any other internal damage." Dr. Hayes entered the recovery room as they were transferring the patient. "Excellent work, both of you. Washington will be pleased to hear that all 3 casualties are stable." "What exactly happened out there?" Dr. Stone asked. "Where did these patients come from?" Dr. Hayes exchanged a look with Agent Morrison, who had just joined them. "That's classified, Doctor. What I can tell you is that these men were involved in a national security operation that went sideways. They needed immediate medical attention from people who could be trusted with sensitive information. And that's why you needed someone with military clearance," Dr. Stone said, understanding beginning to dawn on her face. "Exactly," Agent Morrison confirmed. "Nurse Martinez was the only person in this facility with both the medical expertise and the security clearance necessary to treat Lieutenant Parker." Back in the emergency department, the atmosphere had completely changed. The staff who had witnessed Sarah's transformation from dismissed nurse to confident medical professional were still processing what they had seen. Conversations buzzed quietly around the department as people tried to reconcile the Sarah they thought they knew with the one they had just observed in action. Dr. Williams approached Sarah as she was updating patient charts. "Martinez, Sarah, I owe you an apology. We all do." Sarah looked up from her work. "There's no need to apologize, Doctor. You didn't know about my background." "That's just it," Dr. Williams said, sitting down across from her. "We never bothered to ask. We saw nurse and assumed that was all there was to know about you." "It's not uncommon," Sarah replied diplomatically. "The medical field has its hierarchies." "Well, those hierarchies just got turned upside down," Dr. Williams said. "What you did today, the way you handled those trauma cases, that wasn't just nursing. That was advanced medical practice." Before Sarah could respond, Agent Morrison appeared at her desk. "Sergeant Martinez, I need to speak with you privately." They walked to a quiet conference room where Agent Collins and Dr. Hayes were waiting. Agent Morrison closed the door and activated a small electronic device that Sarah recognized as a security jamming device. "What we're about to discuss is classified," Agent Morrison began. "Your performance today was outstanding, and it's brought some opportunities to our attention." Dr. Hayes leaned forward. "Sarah, we've been authorized to offer you a position with a joint military-civilian medical unit. It's a special operations medical team that handles classified casualties and provides medical support for sensitive missions." Sarah felt her pulse quicken. "What kind of position?" "Senior medical specialist," Agent Collins answered. "You'd maintain your civilian nursing credentials but also hold a reserve military rank. The pay is significantly higher than your current position, and you'd be working with the most advanced medical technology available." "There's just one catch," Agent Morrison added. "The position requires a renewed top-secret clearance and a commitment to be available for emergency deployments, sometimes with very short notice." Sarah considered the offer carefully. It was the opportunity of a lifetime, a chance to use both her nursing skills and her military experience in meaningful work that could make a real difference in national security. "Can I think about it?" she asked. "Of course," Dr. Hayes said. "But we need an answer within 48 hours. The unit is being activated next month." When Sarah returned to the emergency department, she found Dr. Stone waiting for her. The chief of emergency medicine looked uncomfortable, as if she were struggling with what to say. "Sarah," she began hesitantly, "I want to talk to you about what happened today." "Of course, doctor." "Is there a problem with my patient care?" "No, absolutely not. That's exactly what I want to talk about." Dr. Stone gestured toward her office. "Can we speak privately?" In her office, Dr. Stone sat behind her desk, but then stood up again, clearly agitated. "I've been thinking about what I witnessed today, and I'm ashamed of how I've treated you." Sarah remained silent, letting Dr. Stone continue. "For 6 years, you've worked in this department, and I never once took the time to learn about your background or capabilities. I saw nurse on your badge and made assumptions about what you could and couldn't do." "Dr. Stone." "Please, let me finish," Dr. Stone interrupted. "Today I watched you perform medical procedures that I couldn't have done myself. I watched you remain calm under pressure that had me rattled. I watched you take charge of situations that frankly overwhelmed me." She sat down and looked directly at Sarah. "I want to offer you a position as our emergency department's trauma coordinator. It would be a significant pay increase and would give you authority over trauma protocols and training." Sarah was surprised by the offer. "That's a very generous proposal, Doctor." "It's overdue," Dr. Stone said firmly. "You have skills and experience that this hospital needs, and I've been too blind and too arrogant to recognize it." Over the next few hours, word of Sarah's performance spread throughout the hospital. Doctors who had barely acknowledged her existence for 6 years were suddenly seeking her out, asking about her military experience and requesting her input on difficult cases. The change in attitude was dramatic and immediate. Dr. Peterson from surgery stopped by to ask her opinion on a trauma case. Dr. Johnson from the ICU wanted to discuss emergency protocols. Even the hospital administrator, Mr. Chen, made a point of finding Sarah to thank her personally for her exceptional service. "Nurse Martinez," Mr. Chen said, "today you represented Metro General Hospital with distinction. I understand there may be some opportunities coming your way, but I want you to know that we value you here and hope you'll consider staying with us." As her shift ended, Sarah sat in the break room, trying to process everything that had happened. In one day, her entire professional life had been turned upside down. The people who had dismissed her as only a nurse were now treating her as a valued colleague and respected medical professional. Lieutenant Parker, who was recovering well from his surgery, had asked to see her before the federal team transported him to a military medical facility. "Sergeant," he said when she entered his room, "I wanted to thank you personally. You saved my life today." "Just doing my job, Lieutenant," Sarah replied. "No, it was more than that," he insisted. "I've been treated by a lot of military medics, and what you did today was exceptional. Your knowledge, your skills, your calm under pressure, that's the kind of medical professional we need in the field." Agent Morrison appeared in the doorway. "Lieutenant Parker is ready for transport. Sergeant Martinez, have you given any more thought to our offer?" Sarah looked around the room, at Lieutenant Parker, who represented the military world she had left behind, and at the hospital corridor beyond, where her civilian colleagues were finally beginning to see her true worth. "I have," she said finally, "and I've made my decision." The next morning, Sarah arrived at Metro General Hospital to find a different world waiting for her. Dr. Stone greeted her with genuine warmth and respect. Dr. Williams asked for her input on the morning trauma cases. The nursing staff looked at her with new admiration and pride. In the break room, she overheard Dr. Peterson talking to a group of medical students. Remember, medical expertise comes in many forms. Some of the most skilled medical professionals I know are nurses who have experience and training that goes far beyond what you might expect. Sarah smiled to herself, remembering Dr. Stone's speech just weeks ago about nurses being there only to follow orders. How quickly attitudes could change when confronted with reality. Her decision had not been easy. The federal position offered prestige, excitement, and the chance to use her military skills again. But ultimately, Sarah had realized that her true calling was at Metro General Hospital, working with patients who needed her skills and training a new generation of medical professionals to see beyond titles and hierarchy. She had accepted Dr. Stone's offer to become trauma coordinator, but with conditions. She wanted to implement new training programs that would teach all hospital staff about trauma medicine and emergency protocols. She wanted to create cross-training opportunities that would break down the barriers between doctors, nurses, and other medical professionals. Most importantly, she had negotiated for time to serve as a consultant for the Federal Medical Unit, a way to contribute to national security while maintaining her civilian career. As she began her rounds that morning, checking on her patients and coordinating with the medical staff, Sarah reflected on how much had changed in such a short time. The Apache helicopter incident had been a defining moment, not just for her career, but for everyone at Metro General Hospital. Dr. Williams approached her desk with a clipboard full of cases. "Sarah, I wanted to run these trauma protocols by you. Based on what I observed yesterday, I think we need to revise our entire emergency response system." "I'd be happy to help with that, Doctor," Sarah replied. "In fact, I have some ideas about training simulations that might help prepare the staff for situations like yesterday." "Excellent," Dr. Williams said. "I never realized how much we could learn from your military experience." Later that afternoon, as Sarah was reviewing patient charts in the trauma bay, she noticed a group of nursing students observing from the hallway. Their instructor, Mrs. Patterson, brought them over to meet her. "Students," Mrs. Patterson announced, "this is Sarah Martinez, our new trauma coordinator. She's going to talk to you about the importance of continuing education and developing specialized skills." As Sarah looked at the young nursing students, eager, nervous, and full of hope, she thought about her own journey. 6 years ago, she had been in their position, believing that her military experience would be valued in civilian medicine. Instead, she had encountered a system that pigeonholed people based on titles and credentials rather than capabilities and experience. "The most important thing I can tell you," she began, addressing the students, "is that your education doesn't end when you graduate. Every experience you have, every challenge you face, every skill you develop, all of it contributes to your ability to serve patients." She looked around the trauma bay, seeing the equipment and technology that could save lives when operated by skilled hands and informed minds. Don't let anyone tell you what you're capable of based on your title or position. Your worth as a medical professional is determined by your knowledge, your skills, and your commitment to patient care. Everything else is just paperwork. One of the students raised her hand. "Ms. Martinez, how do you handle it when people don't take you seriously because you're a nurse?" Sarah smiled, thinking about the events of the previous day and how dramatically perspectives could change when confronted with reality. "You proved them wrong," she said simply. "Not with words, but with actions. You become so good at what you do, so knowledgeable and skilled, that they have no choice but to respect you." As the students left, chattering excitedly among themselves, Sarah returned to her work. The emergency department was busy as always, but now she was working with colleagues who valued her contributions and sought her expertise. The Apache helicopter incident had lasted only a few hours, but its impact would be felt for years to come. It had revealed truths that had been hidden by assumptions and hierarchies. It had shown that expertise and competence could come from unexpected places, and that the most important qualities in a medical professional weren't titles or degrees, but knowledge, skill, and the ability to remain calm under pressure. Sarah Martinez was no longer only a nurse. She was a medical professional whose unique combination of civilian nursing skills and military trauma experience made her invaluable to her colleagues and patients. The people who had once dismissed her now sought her guidance, and the hospital that had undervalued her was now proud to have her as a leader. The transformation had been sudden and dramatic, but it was also permanent. Once people had seen what Sarah was truly capable of, there was no going back to the old assumptions and prejudices. She had proven that sometimes the most important person in the room is the one that everyone else underestimated.